What the heck is going on in this image? Is that some sort of necrosis? We'll figure that out later. My name's Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. We're going to be discussing cell injury pathology. Let's get to it. Make sure you have this book if you want to get the most out of these lectures and do extremely well in pathology. It tells you everything that you need to know about pathology for medical school and for step 1. If I was you, I would have it. Cell injury. Okay. When the stress exceeds a cell's ability to adapt, cell injury may occur. The likelihood of cellular injury occurring depends on the types of cells involved, the types of stresses involved, the severity of the stress or stressors, and how long it's going on, the duration of the stress. Please note that neurons are extremely sensitive to ischemia, lack of oxygen. And also keep in mind that compared to neurons, skeletal muscle cells are less sensitive to ischemia. Acute injury can result from acute ischemia, such as a stroke, and atrophy can result from slow developing ischemia, such as renal artery atherosclerosis, leading to an atrophic kidney. Now, what are some common causes of cellular injury? Well, those include inflammation, nutritional deficiency, nutritional excess, hypoxia, trauma, and genetic issues. Now here we see the same image of ischemic bowel. Now how did that happen? Well, it highly likely happened due to hypoxia. What is hypoxia? Let's break it down. Hypo means low. Oxia means oxygen. Hypoxia means low oxygen. Make sense? Tissues are dependent on oxygen for the generation of ATP. Hypoxia may result in low oxygen delivery to tissue. Hypoxia is an important cause of cellular injury. Now we all know that oxygen is the final electron acceptor in the electron transport chain, right, in the mitochondria. Decreased oxygen impairs oxidative phosphorylation. Decreased oxygen results in, guess what? Decreased ATP production. If there's no oxygen, you can't produce ATP through the oxygen transport chain, that is. And lack of ATP leads to cellular injury. Now, what are some causes of hypoxia? Well, there's 3 to keep in mind: ischemia, hypoxemia, and decreased oxygen carrying capacity. Here on the right side, we have an image of cellular interaction of an infarct demarcation zone. Why? Well, hypoxia occurred. Now, ischemia. Ischemia is decreased blood flow through an organ. Ischemia may be due to decreased arterial perfusion, like atherosclerosis, with that plaque buildup along the walls of a vessel. Now, ischemia can also be due to decreased venous drainage. For example, Budd-Chiari syndrome. We're going to talk about that later. Also, ischemia can be due to shock, which results in a generalized decreased perfusion of organs. Now, it's a very important thing to know. Shock. You're going to be asked several questions about shock. And it's important to know in the wards and the ED, right? So it's important to understand the differences of the various shocks. So we're going to talk about that in some detail. So what are the types of shock that you need to know? Hypovolemic shock, neurogenic shock, septic shock, cardiogenic shock, and anaphylactic shock. And there's terms within those various shocks that should point you in the right direction of the etiology, right? Hypovolemic, low volume. Neurogenic, relating to neurons. Septic, relating to an infection by some microbial organism. Cardiogenic, the heart. Anaphylactic, some sort of toxin causing anaphylaxis. Now, hypoxemia is technically a lower partial pressure of oxygen in the blood. Remember from lung physiology that FiO2 goes to P big AO2, which goes to P little AO2, which goes to SaO2, right? Now, here are some important numbers that define hypoxemia, right? Because the specific partial pressure that defines hypoxemia is a PaO2 less than 60 millimeters mercury, or an oxygen saturation, SaO2, less than 90%, right? A PaO2 less than 60 and a SaO2 less than 90%. Those are very important numbers to know. Hypoxemia can be caused by hypoventilation, for example, carbon dioxide buildup in the lungs, leading to an increased P big ACO2. VQ mismatch can cause hypoxemia. High altitude, such as a decreased FiO2, can cause hypoxemia. For all my hikers and skiers out there who have first-hand experience with this. Diffusion defect, right, due to some pathology of the lungs, causing a diffusion defect, for example, thickened alveolar air sacs in the interstitial fibrosis of the lung. What else can cause hypoxemia? Well, a decreased oxygen carrying capacity can cause hypoxemia. If you're not properly carrying oxygen, guess what? Hypoxemia. Now, what can cause that? Well, anemia, the PaO2, and the SaO2, both normal, or carbon monoxide poisoning, where the PaO2 is normal and the SaO2 is decreased. Or methemoglobinemia, with a PaO2 that's normal and a SaO2 that's decreased. Let's talk a little bit about carbon monoxide poisoning. Carbon monoxide, CO, carbon monoxide, 1, carbon monoxide, binds hemoglobin stronger than oxygen binds hemoglobin. And that's a problem if you're trying to stay alive. PaO2 would be normal and SaO2 would be decreased. So some values that you would expect to see. Carbon monoxide poisoning can be due to engine exhaust inhalation, right? If it's a Tesla, you don't have to worry about it, or some other electric car. This is from cars with motors that run off of gasoline or diesel, right? Engine exhaust inhalation can cause carbon monoxide poisoning. Unfortunately, this is a method that a lot of suicide attempts are done through, or actual suicides that are successful in a sense. Also, carbon monoxide poisoning can be caused by smoke inhalation, say from a fire. You're in a building, it's on fire, you're trying to get out of there, there's smoke billowing everywhere. Inhalation of that smoke can cause carbon monoxide poisoning. That's part of the reason why you want to crawl and get down under the smoke, if that is the case. Classic symptoms of carbon monoxide poisoning include, you got to know this, a headache early on in exposure, and cherry red skin. Cherry red skin. Look like a cherry. carbon monoxide poisoning. That's a very important point to note. It shows up on many clinical vignettes, and it's a dead giveaway for carbon monoxide poisoning. Note that prolonged carbon monoxide exposure can lead to coma and even death, right? That's why some individuals try to accelerate their death in their car, leaving that engine going, because carbon monoxide poisoning can do that. If you know anyone that's going through this or is thinking about it, make sure you contact the proper people. You got to support those that are going through tough times. On a different note, methemoglobinemia, right? Let's talk about this now. So we all know that heme contains iron, right? You know that. You know heme contains iron. The iron in heme can be oxidized to Fe3+. And Fe3+ cannot bind oxygen. That's going to cause a problem. Patients with methemoglobinemia will have on their labs a normal PaO2 and a decreased SaO2. And there are certain drugs that can cause methemoglobinemia. What are those drugs? I'll tell you. Drugs that may cause methemoglobinemia are classically oxidant stresses, which include sulfa drugs, got to know that, and nitrite drugs, for example, poppers, can cause methemoglobinemia. Note that newborns are at increased risk of methemoglobinemia, okay? Now, what are some signs of clinical methemoglobinemia? If you said chocolate-colored blood, you got to win. Chocolate-colored blood, methemoglobinemia. Chocolate-colored blood, methemoglobinemia, right? It's a dead giveaway. Also, cyanosis. Methemoglobinemia is treated with methylene blue. Methylene blue treats methemoglobinemia, and it's administered intravenously. Now, how does this work? Methylene blue reduces the Fe3+ back to the Fe2+ state, which is capable of binding and transporting oxygen. Let's talk a little bit about reversible cell injury. Hypoxia results in decreased ATP due to the oxidative phosphorylation chain being negatively impacted. Low ATP negatively affects various pumps and aspects of the cell, such as the sodium-potassium pump or the calcium pump or aerobic glycolysis. Decreased ATP results in issues with cellular function, which include cell swelling, we don't want that, calcinosis, right, abnormal calcium deposits, and lactic acid buildup. The cell swelling occurs due to the sodium-potassium pump not having the ATP needed to function, which results in sodium accumulating in the cell. And if there's more sodium in the cell, water's going to want to move down its concentration gradient to equalize things. So water moves into the cell, causing swelling. Calcinosis occurs due to the calcium 2+ pump not having the ATP needed to function. That's why we get a buildup of calcium. Hypoxia causes the metabolic machinery of the cell to shift from aerobic glycolysis to anaerobic glycolysis. Anaerobic glycolysis produces lactic acid. That lactic acid accumulates in the cell, lowers the cellular pH, which causes denaturation of the proteins. It's a good thing that the initial phase of hypoxic injury is reversible. So keep in mind, key features of reversible cell injury includes cellular swelling, loss of microvilli, membrane blebbing, and decreased protein synthesis. Those are reversible cell injury features. Now we're going to move on to irreversible cell injury. And it's going to be crucial to know the differences of these cell features because you will be asked. The characteristic feature of irreversible cellular injury is membrane damage, right? Damage to the membranes. Irreversible. Cellular membrane damage, mitochondrial membrane damage, lysosomal membrane damage. If there's damage to a membrane, that's irreversible. Please note that membrane damage is the key feature of irreversible cell injury. When the cellular membrane is damaged, cytosolic enzymes are capable of leaking out of the cell into the blood and serum. That's why we're able to measure various lab values, right? That's how we know when people are having heart attacks, because the troponin leaks out of the myocardiocytes, right? Makes sense? Please note that troponin testing for myocardial infarction is based on detecting intracellular components of myocardiocytes that have leaked into the blood and serum via cardiac cell membranes that were damaged due to hypoxia or ischemia. Regarding mitochondrial membrane damage, the electron transport chain would be negatively impacted, and cytochrome C would leak out into the cytosol, causing apoptotic activation. And regarding lysosome and brain damage, these hydrolytic enzymes will leak out into the cytosol and wreak havoc. The final result of irreversible injury is cell death. Now, if you have any questions, comments, or concerns, let me know. Make sure you're subscribed to keep up with the updated information, right? Make sure you have the book. Everything that you need to know to excel, reach your full potential is in there, right? You're going to do great. Keep studying. Happy studying. And I'll see you next time.